I've been talking to patients in their 70s and 80s for decades now, and there's one fear that comes up more often than almost any other: the fear of breaking a hip. Not because of the pain, though that's real, but because they know that one fall, one fracture, and everything changes. Independence goes, freedom goes. And here's what shocked me. Most of them have been told that calcium supplements are their only real defense. But that's just not true. In fact, some of the most powerful things you can do for your bones after 70 have almost nothing to do with calcium at all. And that's what we're talking about today. Hi, I'm Dr. Anthony Fauci, and I've spent the last 25 years working with older adults on exactly this issue: keeping bones strong, keeping people active, and keeping them out of the fracture clinic. What I've learned is that bone health after 70 is not a mystery, and it's not just about what you swallow in a pill. It's about understanding how your bones actually work, what really matters as we age, and then taking action on the things that genuinely make a difference. In the next half hour, we're going to walk through 5 things that science has shown genuinely strengthen bones in people over 70. Some of them might surprise you. Some of them you've probably heard about but didn't realize how powerful they really are. And by the end, you're going to have a clear action plan, things you can start doing this week that will actually work. So stick with me. This is information that could literally change the trajectory of your health. Let me start by being honest about what's happening in your bones right now, especially if you're over 70. And I mean this with no alarm, just facts. Your bones are not static, they're living tissue. They're constantly being broken down and rebuilt. When you're younger, your body rebuilds bone faster than it breaks it down, so your bones get denser and stronger. But somewhere around age 30, that equilibrium shifts. You start losing bone density. It's called bone turnover. And after age 50, that rate of loss accelerates. For women, it gets dramatically worse after menopause because of the drop in estrogen, which normally helps preserve bone density. A landmark study published in the Journal of Bone and Mineral Research back in 2003 found that women in their 70s lose bone density at roughly twice the rate that men do at the same age, though men are certainly not spared. Now here's the critical part. By the time you're 70, you've probably lost somewhere between 20 and 30% of the bone mass you had at your peak. That's not a guess, that's what the research consistently shows. A study from the Mayo Clinic published in 2015 looked at bone density trends across thousands of older adults and found that the acceleration of bone loss really does pick up in the late 60s and 70s. But here's what most people don't understand. It's not just about how much bone you have. It's about the quality of that bone, the structure, the mineral density, how tightly organized it is. You can have someone with technically normal bone density according to a scan, but if the architecture of their bone is compromised, they're still at high risk for fracture. Research from the Framingham Heart Study, which has been following people's health outcomes for decades, found that bone quality, measured by something called trabecular structure, is actually a better predictor of fracture risk than bone density alone. So when we talk about strengthening bones after 70, we're talking about both: adding density where we can, but more importantly, improving the quality and strength of the bone you do have. The reason this matters is because it changes what we focus on. If bone loss were just about minerals and calcium, then yes, supplements would be the answer. But bone quality, bone strength, bone architecture, those respond to different things. They respond to movement, to muscle, to hormonal balance, to nutrition that goes way beyond calcium. That's the revelation that changes everything. Let me address the elephant in the room: calcium supplements. They're everywhere. They're heavily marketed, and I can't tell you how many patients come in and say, "Doc, I'm taking my calcium supplement every day, so my bones must be fine, right?" Not necessarily, and here's why. A major clinical trial called the Calcium Intake Fracture Outcome Study, published in JAMA Internal Medicine in 2022, looked at nearly 12,000 older adults. The researchers wanted to know, does taking calcium supplements actually reduce fracture risk? And what they found was sobering. Calcium supplementation alone, without other interventions, did not significantly reduce the risk of hip fracture, spine fracture, or overall fracture risk in older adults. The effect was minimal. Now, I'm not saying calcium is irrelevant. Your body needs adequate calcium to build and maintain bone. But here's the nuance. Most older adults in developed countries actually get enough calcium through their diet. A nutritional survey by the National Health and Nutrition Examination Survey, or NHANES, which the CDC publishes regularly, found that the average person over 50 in the United States gets somewhere between 800 and 1200 milligrams of calcium per day through food. And the recommended daily allowance is 1000 to 1200 milligrams depending on your age and sex. So many people are actually at or near the target already. What's more, there's emerging evidence that very high calcium supplementation, especially in supplement form, might carry its own risks. A study in the American Journal of Clinical Nutrition from 2016 found that people taking high-dose calcium supplements had increased cardiovascular risk markers compared to those getting calcium through diet. Now, the research is still developing on this, and it's not definitive, but it's enough that major health organizations like the American College of Cardiology have recommended focusing on dietary calcium rather than supplements when possible. The real insight is this: your bones don't fail because you're calcium deficient. They fail because of disuse, because of weakness in the muscles around them, because of hormonal changes, because of inflammation, because of poor balance leading to falls. Calcium is the building block, sure, you need the raw materials. But if you're not sending the right signals to your bones to actually use that calcium, to lay it down and keep it strong, then all the supplements in the world won't help. Think of it like this: calcium is the lumber, but without the construction workers, which are the muscles, the mechanical stress on the bones, the hormonal signals, the lumber just sits there. You need both. Okay, so if calcium supplements alone aren't the answer, what is? Let me walk you through the 5 things that actually move the needle. The first and most powerful tool you have is something that honestly gets the least attention: moving your body in ways that challenge your muscles. Let me explain the physiology here because it's fascinating. When you contract a muscle, it pulls on the bone it's attached to. That mechanical stress is a signal to your bone cells, specifically cells called osteocytes, that the bone needs to be strong. Your bones respond to that signal by strengthening themselves, by laying down more mineral, by improving their architecture. It's use it or lose it, literally. A landmark study published in the Journal of Bone and Mineral Research in 2018 looked at older adults over 65 who did resistance training, things like weightlifting, resistance bands, or bodyweight exercises, twice a week for a year. Compared to a control group that didn't exercise, the people who did resistance training increased their hip bone density by about 1 to 3%. Now that might not sound like much, but at your age, reversing bone loss at all is significant. Most older adults are losing 1 to 2% per year, so this study showed that resistance training could actually stop or reverse that decline. What's crucial is that it wasn't just any exercise. It was resistance exercise, something that challenged the muscles, that required effort. Walking, while excellent for balance and overall health, doesn't generate enough mechanical stress to meaningfully strengthen bones. But lifting weights, using resistance bands, doing squats or step-ups, doing push-ups or wall push-ups, these do. A review published in the journal Osteoporosis International in 2020 analyzed dozens of studies on exercise and bone health in older adults and found that high-intensity resistance training was most effective for the hip and spine, the 2 most critical fracture sites. And here's something important: you don't need to be a bodybuilder. You don't need heavy weights. Studies show that moderate intensity resistance training, things where you feel some effort, where you can do maybe 8 to 12 repetitions before your muscle is tired, is where the magic happens. The frequency also matters. Research suggests that 2 to 3 sessions per week is optimal. A study in the American Journal of Physical Medicine and Rehabilitation from 2019 found that people who did resistance training 2 to 3 times per week saw significantly better bone density improvements than those who did it once a week. Now, there's something different but equally important that I want to talk about, and that's weight-bearing and high-impact activity. This is different from resistance training, though they overlap. Weight-bearing activity means anything where your bones are supporting your body against gravity. Walking, dancing, jumping, climbing stairs, these all count. But here's the key: your bones respond differently to different types of impact. A study in the British Journal of Sports Medicine in 2017 looked at different types of exercise and their effect on bone density. They found that high-impact activities, things like brisk walking, dancing, or even gentle jumping or hopping, were more effective at building bone than low-impact activities like swimming. Now, swimming is great for fitness and for people with arthritis, but for bone health specifically, it's not ideal because your bones aren't bearing weight. One particularly interesting study came out of Australia a few years back. Researchers at the University of Sydney published work in 2014 looking at older women who did brief, high-impact exercises, basically just a few minutes a day of activities that involved jumping or rapid weight shifts. After a year, they had better hip and spine bone density than a control group, and importantly, they had fewer falls and better balance. The mechanism here is fascinating. When you land from even a small jump, or when you do a quick weight shift, there's a brief moment of high force through your skeleton. That force is different from the steady, chronic stress of weight bearing. Your bones seem to respond to variety, to different types of stress. So the ideal approach combines steady weight-bearing activity like daily walking with periodic moments of higher intensity, whether that's stairs, dancing, or gentle jumping if you're able. Here's something that surprised a lot of my patients, and it's really important. Bones are not just minerals. They're about 50% water by weight, but of the solid material, roughly half is mineral and half is organic matrix, mostly protein, specifically a protein called collagen. Collagen gives bone its flexibility and strength. If you don't have enough protein, your bones can be brittle and weak even if they have decent mineral content. A study published in JAMA in 2021 looked at protein intake and fracture risk in older adults. The researchers followed several thousand people over 65 for years and found that those with the lowest protein intake, less than about 45 grams per day, had roughly double the fracture risk of those with higher protein intake. Even more striking, the benefit of additional protein was especially pronounced in people over 70. Another study from the American Journal of Clinical Nutrition in 2017 found that when older adults increased their protein intake to about 1.25 grams per kilogram of body weight per day, which for someone weighing 150 pounds is roughly 80 to 90 grams per day, they had better bone density and better muscle mass, and muscle mass is absolutely critical for bone strength. The reason is twofold. First, the protein provides the building blocks for that collagen matrix we talked about. But second, adequate protein helps your body maintain muscle mass, and muscle mass is actually one of the strongest predictors of bone health. Muscles pull on bone, create mechanical stress, and prevent falls. They're inseparable from bone health. Good sources include lean meat, fish, eggs, Greek yogurt, cottage cheese, legumes, nuts, and seeds. You don't need protein powder, though some people find it convenient. Food sources are excellent, and they give you other nutrients too. Now, vitamin D is technically about calcium absorption, but it's so much more than that, and it's so widely deficient in older adults that it deserves its own discussion here. Vitamin D helps your intestines absorb calcium, yes, but it also has receptors in bone cells themselves, and it plays a direct role in bone remodeling. Without adequate vitamin D, your bones can't properly mineralize, even if you have plenty of calcium. A meta-analysis published in the Journal of Clinical Endocrinology and Metabolism in 2018 looked at studies of vitamin D supplementation and fracture risk. They found that vitamin D supplementation, when levels were low, actually did reduce fracture risk, something that pure calcium supplementation didn't do. Here's the problem. Vitamin D deficiency is rampant in older adults. The National Institute of Health released data showing that roughly 40% of Americans over 70 have vitamin D levels below 30 nanograms per milliliter, which is considered insufficient. In northern climates and in people with limited sun exposure, it's even higher. Why does this matter? Because vitamin D comes from sun exposure and from diet, and most older adults don't get enough of either. You need roughly 15 to 30 minutes of midday sun several times a week to generate adequate vitamin D, and that assumes exposed skin and a certain latitude. In winter, in northern climates, or if you have darker skin tone, you generate even less. The recommended blood level of vitamin D for bone health is generally considered to be at least 30 nanograms per milliliter, and some researchers argue for 50 or higher. A study in the Journal of Clinical Endocrinology and Metabolism from 2016 found that older adults with vitamin D levels above 50 had significantly better hip bone density than those below 30. Dietary sources include fatty fish like salmon, sardines, and mackerel, egg yolks, and fortified foods like milk. But honestly, for most older adults, especially those in northern climates, a supplement makes sense. The dose typically recommended for people over 50 is 400 to 600 international units daily for those with adequate sun exposure, and up to 1,000 to 2,000 units for those with limited sun exposure or known deficiency. This should be checked with a blood test. Ask your doctor to check your vitamin D level. It's simple and inexpensive. The fifth thing I want to talk about might seem disconnected from bone strength, but it's absolutely central to your fracture risk. It's fall prevention and balance. This might seem like it has nothing to do with bone quality, but let me explain why it matters so much. The reality is that stronger bones don't matter if you fall, and for many older adults, a fall is more likely than bone loss itself to result in fracture. A study published in the American Journal of Preventive Medicine in 2019 looked at the leading causes of fractures in older adults. 17% of the variation in who gets fractured hips came down to bone density. 83% came down to other factors, primarily fall risk and fall mechanics, how you fall, whether you can break your fall, your balance. This makes sense intuitively. Someone with very weak bones but excellent balance who never falls will never fracture. Someone with normal bones who falls hard or loses balance can fracture easily. Improving balance is learnable. A systematic review published in the Cochrane database in 2020 looked at interventions to reduce falls in older people living in the community. They found that exercise programs that specifically trained balance, things like Tai Chi, standing on one foot, tandem walking, reduced the risk of falls by about 20 to 30%. Tai Chi, specifically, has some fascinating research behind it. A study in JAMA in 2016 looked at a group of older adults and found that those who did Tai Chi reduced their fall risk by 27% compared to controls. They also had better balance, better proprioception, the sense of where your body is in space, and improved bone density. Tai Chi combines many of our pillars. It's weight-bearing, it engages muscles, it improves balance, and it's gentle enough for most older adults. Home modifications also matter enormously. Removing tripping hazards, improving lighting, installing grab bars, wearing appropriate footwear. These aren't glamorous, but a study in injury prevention in 2017 found that home modifications reduced fall risk by about 30% in older adults living independently. So let me bring this together into something you can actually do, starting this week. First, I want you to think about your current activity level. Are you doing any resistance training? If the honest answer is no, that's okay, you're not alone. But I want you to commit to starting. You don't need a gym membership. Resistance bands cost $15. Bodyweight exercises cost nothing. YouTube has hundreds of free resistance training videos designed specifically for older adults. I'd suggest finding a 20 to 30-minute video and committing to doing it twice a week. That's it, just 2 times per week. You'll be amazed at the change. Second, increase your daily walking and weight-bearing activity. This doesn't mean competitive walking. It means getting up and moving. Aim for at least 30 minutes a day most days of the week. If that's ambitious, start with 15. The goal is consistency, not intensity. Daily movement is better than one big workout. Third, look at your protein intake. I want you to aim for about 1.25 grams per kilogram of body weight daily. For someone weighing 150 pounds, that's roughly 80 grams per day. That might mean adding an extra serving of fish or chicken at dinner, or including Greek yogurt at breakfast, or having a handful of nuts as a snack. It's not complicated. Fourth, ask your doctor to check your vitamin D level if they haven't recently. If it's below 30, discuss supplementation. Most older adults will benefit from a supplement of 1,000 to 2,000 IU daily, but your doctor can tailor this based on your level and your sun exposure. Fifth, think about fall prevention. Walk through your home. Are there throw rugs you could trip on? Is the lighting adequate? Would grab bars help? These are simple changes that have real impact. Now, I want to acknowledge something. If you're 70 or 80 or older, you might have arthritis, you might have mobility limitations, you might have health conditions that make some of this challenging. That's okay. The point is not to do everything perfectly. The point is to do what you can, consistently. Even modest resistance training helps. Even 10 minutes of daily walking helps. Even working on balance helps. And here's what I've seen again and again. People are surprised by how quickly their body responds. Bone remodeling takes time. You won't see huge changes in 3 months. But muscle strength improves in weeks. Balance improves in weeks. Energy improves. Confidence improves. And over 6 months to a year, bone density does improve. If you're watching this and you found it helpful, I'd appreciate it if you'd subscribe to the channel. We talk about evidence-based health information for older adults regularly, and having you along makes it worthwhile. Drop a comment below and let me know what resonates with you, or what questions you have. And share this with anyone in your life who's concerned about bone health. You might be giving them information that genuinely changes their life. Finally, I want to say this. Aging is not a disease. Losing bone strength is part of the biological process of aging, sure, but it's not inevitable that you become frail or that you fracture. You have power here. You have agency. The information we've talked about today, resistance training, weight-bearing activity, adequate protein, vitamin D, fall prevention, these are things you control, and they work. Take care of yourself. Your future self will thank you.